So you're thinking about having a breast reduction. This is a very difficult decision to make, and it's important to only go for the surgical procedure if you are 100% sure that this is something that you want to do. Before deciding on a breast reduction, it's important to know how the breast reduction will change your breasts. The breast reduction is aimed at reducing the volume of the breast, and also at the same time we can change the shape and lift the nipples. This will have a significant functional improvement due to the reduction in weight in the front of the chest. It will also improve your activity levels and hopefully your confidence. This is one of the most satisfying procedures both for myself and also for my patients. The breast reduction, however, is exactly that, a breast reduction. The base of the breast can sometimes be lifted, however, the reduction does not give you an implanted look. The volume in the upper part of your breast, particularly below your neckline or your décolletage, will be similar to what you have now. If you are looking for an augmented look, in the high upper pole of your breast, this is the region just below the neckline, a breast reduction will not achieve this. You will need to look at something different, like a breast augmentation with implants, to achieve this look, particularly in a bra. Therefore, in terms of expectations, it's important to be aware that the breast reduction will reduce and change the shape of the breast in a very natural way. Once we have decided that you would like to have a breast reduction, we do need to prepare you for the surgery. This means optimizing you to make sure that the risks are limited and as reduced as possible. Although the surgical procedure has great satisfaction rates, it's not without risks. To reduce those risks, we need to prepare you by stopping smoking. I would advise you not to have any cigarettes if you are a smoker at least 2 months before and after the surgery. Maintain a healthy weight. Those who have a healthy weight have a better outcome in terms of surgical complications, but also they have a better outcome in terms of cosmetic appearance. And I will go into this in a little bit more detail at the consultation. I would also advise no long haul flights, 6 to 8 weeks before the surgery and 6 to 8 weeks after the surgery. Once we have decided you are fully prepared and optimized, we will proceed for the surgery. The surgery itself takes about 2 to 3 hours under general anesthetic. I will advise you to bring a bra a cup size bigger than what your predicted final volume will be, and I will apply this immediately after surgery. You will be strapped up with this bra on top. This would need to be kept intact for the full week after surgery. It's important to keep your dressings dry and avoid any heavy lifting and bending over. You will have some stinging sensations, particularly around the nipple and underneath the breast. The dressings need to be intact for a full week until you see the dressings clinic nurses after your surgery, when everything will be removed. There will be a significant amount of swelling at this stage, so it's important not to judge your breasts. You will need to wear a post-op bra for approximately 6 to 8 weeks after the surgery. There will be a significant amount of swelling in the first 3 months as this settles down. It can take up to a full year for all the swelling to reduce. The scars initially will be dark, but they will fade with time, and after about 4 weeks we will advise you to massage these areas to help improve the scars. During this period, you will feel some pulling, particularly on the side of the breast, and you can occasionally get shooting pains of the nerve starting to grow back. In rare situations, you may need secondary surgery to tidy up the scars, particularly underneath the armpit. However, this is a discussion we will have after about 6 months if there are any issues. We all hope to have good results without any complications. However, there are trade-offs, and with every procedure we do, there are risks involved. The trade-offs are that you will have a scar around the nipple, up, down, and underneath the breast. Unfortunately, this procedure is not possible without scarring. The scars will be dark initially, but with time and massage and patience, they do fade. Sometimes you can get stretched or lumpy scarring, and I will assess these to see if further treatment is required. Bleeding. Post-operative bleeding may require emergency treatment to drain the accumulated blood, and a hematoma or a large clot may contribute to infections or other problems. This is rare. Infection. Additional treatment, including antibiotics, hospitalization, or surgery, may be necessary. If you do get an infection, it's likely to be at the T-junction underneath the breast. This is what it may look like in some instances. However, with correct treatment and management, it can heal. Pain of varying intensities and durations may occur and persist after surgery. A breast reduction may not improve the complaints of musculoskeletal pain of the neck, back, or shoulders, and pain of varying intensity and duration may occur and persist after surgery. Change in nipple and skin sensation. You may experience diminished or loss of sensitivity of the nipples and the skin of your breast. Partial or permanent loss of the nipple sensation can occur after a reduction mammoplasty in one or both nipples. Nipple sensation may be lost if the nipple graft techniques are used during the breast reduction. In rare circumstances, the nipple may be lost entirely. Sutures. All the sutures are dissolvable. Sometimes these dissolvable sutures can poke through the skin and become visible. This can cause some irritation and may require removal. Skin discoloration or swelling. Some bruising and swelling normally occurs after a breast reduction. The skin in or near the surgical site can appear either lighter or darker than the surrounding skin. Although uncommon, swelling and skin discoloration may persist for long periods of time in rare situations. It can be permanent. Abnormal scars may occur within the skin and in deeper tissues. Scars may be unattractive and of different color to the surrounding tone. The appearance may vary within the same scar, and sometimes it can become lumpy. Damage to deeper structures. There is also a potential for injury to deeper structures. This is rare, but it's something that we need to be aware of. Firmness and lumpiness. This is due to the internal scarring or fat necrosis. The appearance is not predictable, and it can take many months to settle. Delayed healing. Some areas may not heal normally or take a very long time to heal. Areas of the skin or nipple may die. This may require frequent dressing changes or further surgery to remove the non-healed tissue. Intimate relations. We advise you not to have any intimate relations for about 3 weeks after the surgery. Asymmetry. Some breast asymmetry occurs in most women. Differences in terms of breast and nipple shape, size, and symmetry may occur as normal. Nipple position and shape may not be identical after the surgery. Some skin irregularities at the end of the incision, also known as dog ears, need to be treated. This may be through surgery. Unsatisfactory results. Although good results are expected, you may be disappointed with the results of a breast surgery. If there are complications or unpredictable scar settlement, there is no guarantee that the results that we expected are achieved. Breastfeeding. This may or may not be possible after the surgery and can be unpredictable. Long-term results. Subsequent alterations in breast shape may occur as a result of aging, sun exposure, weight loss, weight gain, pregnancy, menopause, or any other circumstance not related to your surgery. Breast sagginess may normally occur. I hope this information was helpful to you, and good luck in your journey in making a decision.